Hi, I'm Josh Richards. I'm a hand, elbow, and shoulder surgeon in Oakland, California. Today I'm going to talk to you about kids or pediatric elbow fractures. This can be a common injury. The radius or wrist bone is number one, but elbow fractures are number two. And they can be scary. A common age is age 4 or 5. The most common area the elbow breaks is up on this portion above the joint. That's called the supracondylar area. Very common injury. Anyone that works at a children's emergency room sees this a lot. The biggest problem is if the bone bends backwards. So kids will fall on their hand, on their outstretched hand, and their elbow breaks and it bends backwards. It's important to see someone really quickly, either a pediatric orthopedist or a hand surgeon. We both treat them, a lot of them, and determine whether this thing is in the right place or not. Because if it's not in the right place, it really does need to be fixed, which is scary for your 4-year-old. Basically, a very good way to determine that is to get an X-ray of the opposite elbow. So if your surgeon says, "Hey, we want to X-ray the other side," as a comparison, don't be freaked out by that. That's smart. They should. They don't have to if if it's obvious, but if it's subtle, it's nice to have that opposite X-ray to kind of compare. As kids grow, their elbows change on X-ray, so they look very different every year. So having a normal comparison is helpful. And what we're trying to determine is how far bent backwards is this supracondylar fracture. If it is bent backwards, then typically surgery is going to be necessary. What is surgery? It's not too terrible. The kid gets sedated, we push the bone back in place, and then put 2 typically temporary wires in the elbow. That sounds awful, but as I'm sure you know, kids show up in the emergency room with bent bones all the time, and the emergency doctor is straightening them. So it's basically the same thing, but with a little extra poke hole in the skin with a wire that goes in. Now it does add some risks, don't get me wrong, I'm not trying to minimize it. You can get an infection, there's a little bit of bleeding, injuries to nerves can happen, it's super rare, but if it's a good surgeon who's done a lot of these, I think it's less likely. But some of these injuries are really bad, and so if the fracture is really displaced backwards significantly, something called a type 3, that's a potentially bad injury. So that's typically something that's going to be dealt with that day. The emergency room is going to assess it, they're going to call the surgeon in, and then the surgeon is going to decide what to do about that, which typically is going to be surgery not a week later, but sometime in the next 24 hours. So most of them, however, are not bent very much at all, or not bent at all. That's a long arm cast for a month, basically. Could be a waterproof cast if there's no pins involved. The ones that are bent and need to be pinned, unfortunately, water can't be getting on those pins, so there's no waterproof cast in that scenario. Sometimes, most of the time, it's not bent much at all. The emergency room would just put you in a splint and tell you to follow up with a orthopedic surgeon, and in that scenario, try to get in as quick as possible, because if it is bent and needs to be moved, the sooner the better. Generally by 4 to 6 days, this thing starts to heal, especially in a 4-year-old, where it makes it hard to move it. So ideally, you get in quickly to get that assessed and potentially pinned if need be. Typically, there aren't any long-term problems, but it can happen. So this is an injury that does happen around the growth plate, so growth problems are possible, albeit extremely unlikely. Obviously, the more severe the injury, the more potential problem for that. So super rare in a non-displaced fracture, but possible if it's a really bad injury. Typically once they get out of the cast, it's usually pretty easy from there. There's a couple days of hesitation, and then they just start doing their thing. So there's about 3 or 5 days. Most kids are hesitant, and then it's almost like they forgot about it. Whereas an adult, it takes us like 4 months to get over this. It takes them like 4 days to get over it. So The surgeon will tell you whether it's healed and ready to go. Sometimes it takes a little longer than 4 weeks, and so you might need to be cast longer. Sometimes kids get real stiff and need some therapy, but that's more unusual, especially on the younger you are, the less likely to get stiff. But if you're more in the 8 to 10 range, you probably will be stiff and need some therapy. The occasional one has a hard time healing, but it's super rare. The biggest thing is to get in as quick as you can with a good orthopedic surgeon, either hand elbow specialist or pediatric specialist, more ideal, and then get it assessed for stability, which means it can just be casted or it doesn't need to be fixed. Thank you.